People managing diabetes often focus on blood sugar, insulin, medications, and diet. But one area that deserves just as much attention is how vitamins and supplements can interact with the condition. Not all supplements are created equal, and more importantly, not all combinations are safe. Before we continue, I'd like to tell you about Diacelan, a powerful blend of 13 natural ingredients, each carefully selected for their proven ability to support healthy blood sugar levels, enhance insulin sensitivity, and promote overall wellness. You can read more on diacelan.com. One pairing in particular can be surprisingly risky for anyone living with diabetes: vitamin E and vitamin K. These two fat-soluble vitamins may seem harmless on their own, but when taken together, especially in supplement form, they can lead to dangerous complications. Understanding why this combination can be harmful is crucial for maintaining both short and long-term health when managing diabetes. Diabetes is more than just a blood sugar disorder. It affects nearly every system in the body. It increases the risk for nerve damage, heart disease, kidney issues, and poor wound healing. Because of this, many people with diabetes turn to vitamins and dietary supplements to support their overall health. Supplements like magnesium, vitamin D, and B-complex vitamins are often recommended to help address deficiencies and improve metabolic function. However, this growing trend of combining various supplements without professional guidance can lead to unintended consequences. In particular, combining certain fat-soluble vitamins, like vitamin E and vitamin K, can create a silent but serious risk, especially for individuals taking medications or managing cardiovascular complications common in diabetes. Vitamin E is known for its antioxidant properties. It helps protect the body from oxidative stress, a condition where harmful molecules called free radicals damage cells. This protection is important for people with diabetes who are often dealing with chronic inflammation and cellular stress due to elevated blood sugar levels. Vitamin K, by contrast, plays a key role in blood clotting and bone health. It helps regulate calcium in the bloodstream and ensures proper clot formation when injuries occur. Both vitamins are important, and both are commonly found in multivitamins and standalone supplements. But when taken together, especially in large doses, they can interact in ways that disrupt the body's natural processes, particularly those involving the cardiovascular system and liver function. One of the biggest concerns is how vitamin E and vitamin K influence the blood. Vitamin E acts as a mild anticoagulant, meaning it reduces the blood's ability to clot by limiting platelet aggregation. This action is considered beneficial in some cardiovascular contexts, but it can also increase the risk of bleeding. Vitamin K, however, works in the opposite direction. It activates clotting proteins and helps the blood clot effectively. When these two vitamins are taken together in supplement form, they send opposing signals to the body. This can create an unstable environment in the circulatory system, particularly for people with diabetes who already face higher risks for vascular issues like deep vein thrombosis, stroke, and slow healing wounds. The potential danger grows even larger when prescription medications are part of the picture. Many people with diabetes take blood thinners such as warfarin or aspirin, as well as medications that affect liver function or glucose metabolism. Vitamin K can interfere with the function of warfarin by counteracting its effects, making the blood more likely to clot. At the same time, vitamin E can enhance the effects of blood thinners, increasing the risk of bleeding. This creates a situation where the supplements and medications work against one another, leading to unpredictable results. For someone managing diabetes and cardiovascular disease simultaneously, this interaction could lead to excessive bruising, internal bleeding, or a clotting episode like a stroke. The liver plays an important role in this equation as well. Both vitamin E and vitamin K are fat-soluble, which means they are stored in fat tissue in the liver rather than being flushed out of the body like water-soluble vitamins. This storage capacity can lead to a buildup over time, especially when supplements are taken daily. The liver is already heavily involved in glucose regulation, medication processing, and detoxification. When it is also burdened with metabolizing excess fat-soluble vitamins, liver function may become impaired. For someone with diabetes, especially if they also have fatty liver disease, this could lead to slower medication clearance, increased insulin resistance, and a higher risk of liver damage. There's also evidence that both vitamins can impact insulin sensitivity and how the body processes glucose. Some studies suggest that high doses of vitamin E, especially when taken without a proper nutrient balance, may actually impair insulin signaling pathways. This means it could reduce the body's ability to use insulin effectively, a serious problem for people already struggling with insulin resistance. Vitamin K has its own hormonal effects. It interacts with proteins like osteocalcin, which can influence insulin production and glucose metabolism. In theory, one vitamin could interfere with how the other influences blood sugar regulation. This interaction is not fully understood, but the existing data shows that taking these two vitamins together in uncontrolled doses introduces unnecessary risk. Unlike water-soluble vitamins that the body can flush out quickly, fat-soluble vitamins stay in the system for longer periods, meaning their effects are cumulative. You might not feel anything for days or even weeks, but over time, signs of trouble can start to show. Unusual fatigue, easy bruising, prolonged bleeding after small cuts, or even unexplained swings in blood sugar could all be signs that these vitamins are accumulating and interfering with your body's balance. These symptoms often go unnoticed until they develop into more serious issues. For someone managing a chronic condition like diabetes, this kind of slow-building damage is especially dangerous because it undermines the stability that's so crucial for long-term health. Certain individuals face even higher risks. People over the age of 60, those with type 2 diabetes and excess body weight, or individuals who are taking more than one prescription drug are at greater risk of experiencing adverse interactions. This is particularly true for those with a history of cardiovascular disease, liver issues, or blood clotting disorders. For these individuals, even small changes in vitamin intake can disrupt an already delicate balance. Supplements that seem harmless on the surface can contribute to complications that increase the risk of stroke, heart attack, or organ damage. This is why it's so important not to assume that more is better when it comes to vitamins, and not to combine supplements without understanding how they interact. Safer strategies begin with focusing on whole food sources of these vitamins. Vitamin K is abundant in leafy greens like spinach, kale, collard greens, and broccoli. These foods provide manageable, balanced doses of vitamin K that the body can use more efficiently. Vitamin E is found in sunflower seeds, almonds, avocados, and plant-based oils. Getting these nutrients from food allows the body to absorb them in a natural way, supported by fiber and other compounds that help regulate their effects. It's much harder to overdose or create an imbalance through food alone, and whole foods offer the added benefit of supporting digestive and metabolic health as part of a balanced diet. When supplementation is necessary due to deficiency or a specific medical need, the first step should always be to speak with a healthcare provider. A blood test can reveal whether you're low in one or both vitamins, and your doctor can help determine the right dosage and schedule for supplementation. It's also smart to space out supplements. If both vitamins are required, taking one in the morning and the other in the evening can reduce their competition for absorption and may help minimize interaction risks. Additionally, always read supplement labels closely. Avoid products that bundle vitamin E and K together, unless they are specifically designed for people with diabetes and have been cleared by a doctor. Safer alternatives for managing diabetes through supplements include options that have a better track record and clearer benefits. Vitamin D, for instance, is frequently low in people with diabetes and has been shown to support better insulin sensitivity and reduce inflammation. Magnesium helps with blood sugar regulation and reduces muscle cramps, a common issue in diabetes. Chromium can help improve insulin action, and alpha-lipoic acid is widely used for nerve protection and glucose metabolism. These supplements still require supervision, but generally present fewer complications when paired with medications or other nutrients. To wrap up, the takeaway from all of this is clear. When you're managing a complex condition like diabetes, every decision you make, no matter how small it seems, can have far-reaching consequences. Supplements are often seen as harmless, even beneficial, because they're natural or widely available without a prescription, but natural doesn't always mean safe. The combination of vitamin E and vitamin K is a perfect example of how two nutrients that are beneficial on their own can create harmful effects when used improperly. In this case, they can send mixed signals to your cardiovascular system, interfere with medications, burden the liver, and potentially disrupt your blood sugar and insulin regulation. And the most dangerous part, you may not even feel it happening until the damage is already done. It's also important to remember that the risk is amplified in people with diabetes. This condition already puts extra stress on your circulatory, metabolic, and nervous systems. It increases your chances of developing heart disease, suffering nerve damage, and experiencing poor wound healing or slow recovery from injuries. Adding a conflicting supplement combination like vitamin E and K on top of that creates additional strain that your body doesn't need. It's like throwing a wrench into an already delicate machine. You might be trying to help your body, but without understanding the full picture, you could be unknowingly making things harder for it. This is why supplement use should never be based on guesswork, internet trends, or generalized advice. What works for one person may not be appropriate for someone else, especially when diabetes, medications, and other chronic health concerns are in the mix. A responsible approach starts with education, continues with professional guidance, and ends with informed decision-making. That means talking to your healthcare provider before adding anything new to your routine. It means asking questions, reading labels carefully, understanding your medication interactions, and keeping track of how your body responds over time. Supplements should support your treatment, not complicate it. When you focus on nutrient-dense meals with a variety of vegetables, lean proteins, healthy fats, and whole grains, your body gets what it needs in a form it recognizes and knows how to handle. Leafy greens for vitamin K, nuts and seeds for vitamin E. These foods not only provide the vitamins in question, but they also deliver fiber, antioxidants, and other health-supporting compounds that help stabilize blood sugar, reduce inflammation, and support organ health. So what should you do moving forward? First, evaluate your current supplement routine. If you're taking both vitamin E and K, especially in high doses or from a multivitamin, you need to stop and consult with a healthcare professional. Ask for blood work to determine if you even need either one. If a deficiency is present, it can be corrected in a controlled, medically supervised way. Next, focus on whole foods. Build your diet around natural sources of nutrients instead of relying on pills. And finally, shift your mindset about supplements. They aren't a shortcut to health or a replacement for a poor diet. They're tools. And just like any tool, they can help when used correctly or cause damage when used carelessly. Ultimately, the goal with diabetes, or any chronic condition, isn't just survival, it's quality of life. That means protecting your vision, your kidneys, your nerves, your heart, your brain. It means maintaining your energy, your independence, and your long-term well-being. And every choice you make, whether it's your dinner plate or your supplement bottle, either moves you closer to that goal or farther away from it. The combination of vitamin E and K is one of those seemingly small decisions that can tip the balance in the wrong direction. But now you have the knowledge to recognize the risk and avoid it. Your health isn't about perfection. It's about being proactive, understanding your body, listening to it, and working with healthcare professionals to support it intelligently. That's the kind of empowerment that leads to real, lasting improvements. So take this information seriously. Review your current habits, make changes where needed, and always remember, managing diabetes isn't just about blood sugar, it's about everything you do to keep your body in balance. And smart supplementation is one of the most powerful tools you have when used the right way.